Well, aside pharmaceutical solutions, one of the 5 precautions to lower the risk of COVID-19 infection is cleaning of the hands. Perhaps inadvertently given some bite to that expression, it's in your hands. Incidentally, the world will be commemorating Hand Hygiene Day, and the message this year is Seconds Save Lives. Clean your hands. Well, let's talk about that aspect of this fight against COVID-19 and more. Dr. Olaolu Aderiola is the head of Response Division at the Nigeria Center for Disease Control, NCDC. He joins us from Abuja studio. It's great to have you on the program. But I'd like to begin with this new travel restriction, if you may. Let me just ask you, are you confident, really, first, with the manpower we have at the entry point, and how effective this will be in curbing a possible surge?
Thank you for having me. Yes, there are concerns about this, but we can see that government has been working hard to ensure that we reduce the risk of any importation of new strains into the country. We'll try as hard as we can, and we believe that with the good work that has been done at the point of entry manned by the Port Health Services of the Federal Ministry of Health, they'll continue in this task to ensure that there is strict monitoring of those who come in and adherence to this. If we do this, this will really help to reduce the risk, to minimize the risks quite significantly. And this is what the country has been doing, and we are very confident that the manpower will still continue the work they are doing. And government is also looking at how to really help in ensuring that compliance is done, and the health workforce is being supported to be able to get this job done.
You know, the peculiar thing about this fight against COVID-19 is the fact that the battle is being fought on different fronts. You have vaccination drive, you have the talk about travel restrictions, but let's talk about the non-pharmaceutical means. Now, we may take this for granted. I mean, it's been over a year, and we've been saying the same things. Wear a mask, keep physical distance, open windows, clean your hands and all. So let me just ask you, at the risk of sounding like a broken record, just how much do these measures work in protecting against the virus?
So the non-pharmaceutical interventions really work a lot. It might look simple, but they are very effective. We are currently looking at World Hand Hygiene Day, which will be marked on the 5th of May, and NCDC also joins global partners in this. It's been shown that hand hygiene helps to reduce about 50% of infections that is transmitted, either respiratory or oral or fecal-oral. And this has really shown that, it has also shown that it reduces the returns we get on savings on implementing this is about 16 times of this. And we also know that prevention is always better than cure. So the slogan of this year, Seconds Save Lives, is just very apt, because just taking that action really helps a lot. You know, cleanliness is next to godliness, and doing those simple things really help, and it breaks the chain of transmission of infection. So it may seem very simple, but it's a behavioral issue. It shouldn't just be something that we do when an outbreak occurs. It's something that needs to be done constantly by healthcare workers and the general public to ensure that our hands are clean, and other interventions are made, the physical distancing, the wearing of the mask. It has really saved so many lives, and it has reduced, it has been able to break the chain of transmission in the country.
And we do hope that the NCDC can properly drive, these points home, and maybe tweak that to cleanliness is next to wellness as well. Well, I'd like to thank you so much, Dr. Olaolu Aderiola, who's the head of Response Division at the NCDC.
Thank you.